This week on Healthy Living, February is Cervical Cancer Awareness Month. We'll look at Zambia's efforts to tackle the disease. And activists in the U.S. aim to shed more light on the mental health impacts of social media. Plus, is there really any benefit to vitamins and supplements? These stories and more in this edition of Healthy Living. Hello, I'm Lina Moudou. Welcome to Healthy Living. It is called a silent killer and is the fourth most common cancer in women globally. Cervical cancer is caused by infections with the human papillomavirus, a common virus often transmitted through sexual contact. According to the World Health Organization, nearly 604,000 women were newly diagnosed with cervical cancer in 2020. 342,000 women lost their lives to the disease, and 90% of the victims were in low and middle income countries. Cervical cancer can be prevented or treated if diagnosed at an early stage. The highest rates of cervical cancer incidence and mortality are in sub-Saharan Africa. Zambia has one of the highest rates on the continent after Eswatini and Malawi. Authorities say more than 3,000 women are diagnosed with the disease and almost 2,000 die from cancer annually.
Karen Nakawala, a public figure and media personality, survived cervical cancer 4 years ago, but many of her friends have not been that fortunate. She's the founder and executive director of a non-profit organization, Tio Sisters Foundation Zambia, aimed at fighting cervical cancer and giving hope to affected communities and survivors. The organization also encourages more women to go for early screening. Nakawala's Facebook page, which has more than 130,000 followers, promotes discussions on cancer and offers support and advocacy. Nakawala, who is also a WHO advocate, does not shy from speaking about sexuality on air as she strives to encourage communities in a country that is still conservative on such matters. Reports indicate that some men do not allow their wives to go for screening due to myths associated with cervical cancer.
We are able to break the silence around cervical cancer by using people like myself and the other survivors that we have, Two Sisters and a lot of survivors. So if we use Two Sisters, that's an opportunity for us to show people that, you know what, cancer is, yes, it is a deadly disease, but it is curable.
According to the World Health Organization, cervical cancer develops in a woman's cervix. Almost all cervical cancer cases are linked to infection with high-risk human papilloma viruses, or HPV, a very common virus transmitted through sexual contact. When diagnosed early, cervical cancer is one of the most successfully treatable forms of cancer. Rebecca Siambwati, a cervical cancer survivor, says she was scared when she was diagnosed with the disease 5 years ago. She sought support through Tio Sisters Foundation. She also underwent free chemotherapy treatment at the country's only cancer diseases hospital in Lusaka.
Because in the community, when somebody is diagnosed with a cancer, it was made that somebody is going to die. So I was thinking a lot about my children, leaving my children behind. So it wasn't easy for me. Not at all. There was no payment that was made on my treatment. It was just a free treatment. So I was very happy because I didn't have money to pay.
Dr. Catherine Mwaba, head clinical and radiation oncology section at the Cancer Diseases Hospital, told VOA recently that overall, the number of new patients seen each year varies from 2,700 to 3,000 for various types of cancer. There is only one Cancer Diseases Hospital catering for a population of 20 million people. Many patients have to travel long distances to access treatment. Zambian Health Minister Sylvia Masebo announced recently that plans are underway to build 2 more Cancer Diseases hospitals in various parts of the country. Dr. Chuma Njovu, Zambia Medical Association's chairperson for research and education, emphasizes the need to strengthen vaccination campaigns, especially in rural areas where there are more cases of cervical cancer.
We need to focus on prevention. So this is what has to be pronounced strongly we have to strongly look at prevention. Prevention comes at different levels, so there's primary, secondary, and tertiary. But at the moment, we should focus on primary and secondary prevention, where we emphasize on vaccination. This program has been rolled out already.
Zambian authorities, with support from the World Health Organization, WHO, have rolled out a national strategic plan based on the UN's 3 global cervical cancer elimination strategy. The UN strategy focuses on vaccinating 90% of Zambian girls against the human papillomavirus, or HPV, screening at least 70% of women, and building capacity to ensure that 90% of women diagnosed with precancerous cells or cancer receive treatment. For VOA, I'm Kathy Short, Lusaka, Zambia.
Do you know what causes cervical cancer and how to prevent it? If you are a woman, how concerned are you about cervical cancer? Here are some reactions from Nairobi, Kenya.
I think what causes cervical cancer is infection mostly. Let's say some sexually transmitted diseases.
There are so many high risk of us female getting it, and the faculty of health cannot be able to manage all of us, and the equipment are not well equipped for helping us.
Of course, I'm concerned about cervical cancer because I love myself, and I think that it is important for women to take care of their reproductive health.
Most of the people, the population, they are not concerned, they are not aware about the threat.
I'm concerned because cervical cancer is something that's affecting so many women right now. If you look at the cancer patients, the ratio of men to women, the women are more.
It has the potential to take away human life, and additionally, in the current economy that we are in, it could be detrimental to a family's financial position.
It's one of the rapid things that are going on. Let's say it's almost, from my last research, it's the most rapid cancer going on right now.
Dr. Tafadzwa Zina Marira is the country director for ICAP in Zambia, a global health organization based at Columbia University. He discusses cervical cancer and shares some steps to lower its incidence among African women.
So cervical cancer is one of the most understood cancers in the world, actually. It's the primary risk factor for infection is persistent exposure to the human papillomavirus, HPV, specifically strains 16 and 18 that are termed high-risk HPV strains. So you find that this virus is transmitted during sexual intercourse, and naturally the immune system would clear out the virus naturally. Early stages, it's really asymptomatic, which underscores the need for routine screening. However, depending on the stage of the disease, women can experience some pain during sexual intercourse, pelvic pain, abnormal bleeding. There are some important risk factors for cervical cancer. So in terms of screening, there's a routine method that is used even in low and middle income settings, which is visual inspection with acetic acid. And then there is also the cytology, commonly known as pap smear. And then we now have HPV DNA testing, which is a relatively new testing modality for HPV screening that is actually more sensitive and specific than visual inspection. It is able to detect precancerous lesions. It is important that young girls get sexual and reproductive health information. There is sex education at a young age, so that they are conscientized about cervical cancer, they are conscientized about sex and the risks that come with unprotected sex. And then in terms of primary prevention, which is where our vaccination would come in, it's important that young girls are vaccinated for HPV. There are very good vaccines that are highly effective in preventing cervical cancer that girls can have access to.
Lawmakers and parents are blaming social media platforms for contributing to mental health problems in young people. A group of U.S. states is suing the owner of Instagram and Facebook for promoting their platforms to children despite knowing some of the psychological harms and safety risks they pose. From New York, VOA's Tina Trin reports that a cause and effect relationship between social media and mental health may not be so clear.
33 U.S. states are suing Meta, the owner of Facebook and Instagram, for the social media platform's alleged harm to children's mental and physical health.
In seeking to bolster profits, Meta has repeatedly misled the public about the substantial dangers of its products. It has concealed the ways in which Instagram and Facebook exploit and manipulate its most vulnerable consumers, teenagers and children.
Attorney Matthew Bergman filed earlier social media cyberbullying cases that are now part of the multi-state lawsuit. He says social media platforms are dangerous for young people, less because of their content and more for the way they're designed to promote addiction.
The algorithms are explicitly designed to maximize user engagement, not give kids what they want to see, but give them what they can't look away from.
For its part, Meta says it offers some 30 tools and resources to help teens safeguard their privacy and well-being, including protections against unwanted contact.
So when an adult tries to message a teen who doesn't follow them, they'll see a notification letting them know that messaging the teen isn't an option.
Critics say the social media giant could be doing more, but chooses not to, and the consequences eventually catch up with everyone, even those who worked at Meta.
My 14-year-old daughter joined Instagram. She and her friends began having awful experiences, including repeated unwanted sexual advances, harassment. She reported these incidents to the company, and it did nothing.
There's studies that show that there's benefits to social media use, and there's also studies that show there's no association whatsoever between your well-being and your social media use.
Tamarman says her research with young people shows they want more choice when it comes to online experiences.
They knew that there were these algorithms that were trying to get their attention at no matter what, and they wanted to train the algorithm. They didn't want to say get rid of the algorithm. They wanted to say, you know what, I want you to make sure that you do show me the things that I want to see.
In a separate legal action, Meta is suing the Federal Trade Commission to stop it from reopening a 2020 privacy settlement that included Meta paying $5 billion in fines for privacy violations. The federal agency says Meta has failed to fully comply with that settlement and is seeking changes to an agreement that prohibits it from profiting on data collected from users under the age of 18. Tina Trin, VOA News, New York.
Now, many people take supplements and vitamins regularly as they believe these substances will protect their health. But do vitamin supplements make you healthier? According to experts at Harvard Medical School, multivitamins will have little or no benefit for people who eat a healthy diet, including fruits, vegetables, and good protein sources. However, people who are at risk of nutrient deficiency may benefit from vitamin supplements, such as the elderly having trouble absorbing vitamin B12 from food, pregnant women who need adequate folate to help lower the risk of spina bifida in their babies, people with conditions that interfere with normal digestion, and those who take certain medication. Experts caution that high doses of vitamins can interfere with the absorption of other nutrients or medications and can even become toxic when taken for a long time. It is advised to consult with a healthcare provider or a registered dietitian before taking any supplements. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.